We are engaged in a very important debate on our budget over the last few days, and this debate will continue over the next several weeks and indeed for probably several months. It's not a new debate, and like past debates, at the heart of it are important programs for middle-income Americans like Medicare, Medicaid, and Social Security. And in some quarters, they're under attack. This doesn't have to be the case. We have seen Republican budget proposals, but frankly, I don't think they strengthen the middle class here in the United States, nor do they provide the kind of sensible investment that will lead to job increases and to provide the opportunities that are necessary for the succeeding generations of Americans. They are, I think, more dedicated to an ideological commitment to simply reduce taxes. One of the other aspects of this budget is the impact that it would have on Medicare. Medicare is central to every family in this country. In fact, look around at not just someone who's earning a wage hour by hour, look at the small business person, the man or woman. Their retirement plan rests on the assumption that they will have access to Medicare. The Republican proposal, as I understand, essentially ends that for individuals who are about 52 years old or younger. Now, I guess I've reached the point in my life where I can reflect and remember that as a youngster in the 1950s and certainly before 1965, there was in practically every one of my friends' homes, a grandparent that was there because they didn't have access to Medicare or Medicaid. They were in a hospital bed in a living room or in some other room. They were being cared for by typically the mother, who was also trying to care for youngsters like myself and my contemporaries. And the reason was, regardless of how much money you had, is that at some point, insurance companies will not sell you insurance. You're old, you've had health experiences prior to that, you're a bad risk, and they're not in the business of insuring bad risk. That was, as much as anything, the genesis of Medicare, the recognition that the private health care market would not, regardless of your ability to pay, provide adequate coverage. And I think we've forgotten that. This proposal will do serious harm to health care and to, particularly to the middle-income Americans who, regardless of whether you're running a small business or working for an hourly wage, you will now face the prospect of the great uncertainty, the great unknown of no adequate health care coverage when you reach 65. We will go back in time to the period of my youth where, in fact, frankly, seniors did not have the kind of health care coverage they have today, and I believe the kind of health care coverage that they deserve.